Welcome everyone to the fall prevention presentation in part of Fall Prevention Month, which is November. The VON wanted to play our role in preventing falls by providing educations to seniors, caregivers, and loved ones on how to reduce the risk of falls and to stay independent and aid in healthy aging as much as possible. So the goal for today is to assist you in understanding that falling is not a normal part of aging and can often be prevented and or managed through lifestyle changes and awareness. And we're also going to be providing you with information about, fall prevention programs that are available and other programs and resources that can help you continue your health journey with. So to get started, a little bit about me. Oh, there we go. So a little bit about me. So my name is Skye. As Kayla mentioned, I am a registered kinesiologist, and I'm also the program coordinator for the VON Smart Exercise and Fall Prevention Program here in the Hamilton, Niagara, Brantford region. Now, as a kinesiologist, this is just a fancy way of saying that I am a human movement specialist and can be an excellent resource for health and lifestyle questions regarding things like chronic disease management, bone health, nutrition, home safety, and much more. So my goal today is using my knowledge and experience. I want to help you to improve your knowledge about, fall prevention and again, how we can age healthy and stay independent as much as possible. So hopefully we can gain some of that today. The main things we're going to be talking about during our session, though, is we're going to kind of quickly review what is considered a fall, why fall prevention is important, what are the stats we're noticing here in Canada, and what are some of the trends we see happening in regards to our seniors experiencing falls. We'll review what are some of the big risk factors and why people often experience a fall. And of course, we'll talk about what you can do to reduce those falls. And lastly, go over those programs and resources available out there. So some quick definitions to start. So what is considered a fall? Well, this is an event that results in a person coming to rest advertently on the ground or a lower level with or without an injury. Now, many times we only focus on falls that occur because those are ones that often impact us the most, but we often need to also consider near falls as well, just as seriously as we would an actual fall. So near fall is when you're feeling like you're gonna fall, but you don't. You are either able to catch onto something to give you support or are able to recover your balance. And a lot of times near falls could be a precursor to a fall occurring and something that, again, we should be taking seriously in order to correct or manage whatever the underlying concern is. And another thing I want to start with is to kind of bust a myth for us. So a lot of times we assume as we get older that, we're going to fall. That's just part of aging. And that is actually not the case. So falling is not a normal part of aging. Just because we're getting older doesn't mean we should expect to fall. Falls are often instances where there is an underlying concern or multiple concerns, whether it's, health problems, different lifestyle things that we need to address in order to prevent that fall from happening. So again, just because we're getting older doesn't mean we're supposed to be falling. So that is not a normal part of aging. With that being said, how do falls impact seniors? So let's take a look at the stats we're seeing here in Canada. So right now we're on average seeing about 20 to 30% of older Canadians are experiencing a fall each year. And falls are the leading cause of injury-related hospitalizations among older adults here in Canada as well. And after a fall, many are unable to live the way they want to, where the individual's quality of life is impacted due to an injury, disability, or a condition that is exacerbated by that fall occurring. And unfortunately, this is also reflected in the stats where over 1/3 of older adults will be admitted to long-term care after a fall has happened. Excuse me. So with the stats, this is just giving us a little bit of a snapshot to what older adults are experiencing here in Canada. But I also want to go over something called the post-fall syndrome that will help highlight a little bit more about why fall prevention is important. So on the slide here, we have a little bit of a diagram or an illustration. And I'm going to review this with you to kind of go over a scenario about how this diagram tends to happen in a senior's day-to-day at times. So let's go through a scenario that many of us might be familiar with. Maybe we've experienced ourselves, or this might be a scenario that a loved one or a friend has gone through. So in this scenario, an older adult may experience a fall. And this can happen in a variety of ways. Maybe they're getting up in the middle of the night to go to the washroom and trip over something in their path. Maybe they're going out for a walk in the community. That's their favorite form of exercise. And unfortunately, they've had fallen on the uneven sidewalk, or maybe they didn't see some ice or snow that was a slipping hazard. So whatever the scenario was, they experienced a fall. And what we notice is that after a fall occurs, that individual tends to lose their confidence, a confidence in their ability to perform or participate in that activity where that fall has occurred, and has started to develop a fear of falling. Now, unfortunately, when this confidence goes down, our fear of falling worsens. This causes individuals to restrict their activity. They avoid activities where the fall has occurred for them in the past, or activities they assume they are more likely to fall during. And as a result, with this restriction of activity, this is also impacting their physical health as well as their mental health as well. And we see that they tend to lose some of their physical fitness. So we see a decrease in mobility, a decrease in muscular strength, and as a result, this overall impacts their independence, decreases it quite significantly. Maybe they're no longer able to go out for those walks that helps maintain their physical activity. Maybe they're having trouble keeping up their house, or getting out to engage in activities that keeps them social and part of their community. And as a result, this decrease in independence actually sets them up for a second fall to occur, and it starts creating this cycle that we refer to as the post-fall syndrome cycle, where then multiple falls are occurring. So the goal with fall prevention in a perfect world is ideally we would prevent that first fall from happening. But what actually seems to be the case in most situations is we're using fall prevention to prevent the next fall from happening, to break that cycle at various points. So again, falling is not a normal part of aging. It is going to be due to risk factors that are contributing to an increased risk of falls. And that fear of falling can actually lead to a decrease in independence as well. So hopefully we can learn together today about how we can break this cycle. So we're going to do a little bit of an activity. We don't have to come off of mute for this, but what's going to happen is I'm going to read out some statements, and you can either keep track or give yourself a point if the statement applies to you, either, using your fingers or just keeping track in your own head. And at the end, we're going to use those points that you add up and tally up and determine if you're at an increased risk for falls. So getting started, the first question or statement is have you had a fall in the past year? If that is the case, give yourself a point. Statement number 2, do you worry about falling? If so, give yourself a point. Statement 3, do you often take medications that sometimes makes you feel lightheaded or more tired than usual? Give yourself a point. Do you sometimes feel unsteady when you're walking? Give yourself a point if that applies to you. Do you have any loss of feeling in your feet, like neuropathy, or lack of sensation in the feet? Give yourself a point. And last question, this one's a two-parter. So if even one part of this statement applies to you, give yourself a point. Do you have any difficulty avoiding hazards in your path because you don't see well, or you have difficulty hearing instructions or warnings? So those are our statements here. So hopefully you guys were able to keep track of the statements that apply to you. And based on this risk assessment, we notice that if you have given yourself 2 or more points, then you as an individual are at a greater risk for falls. Now, with that being said, let's kind of review together what some of those risk factors are. So why do people fall? So this one's a little bit of a group activity. So I would love if those of you who are comfortable to maybe unmute yourselves and maybe just list 1 to 3 reasons why someone might experience a fall, or what you think are risk factors to falling. What do you guys think?
Mobility issues.
Mobility issues, definitely. Excellent. Thank you, Gina. What else? Maybe 2 more. Medication from the chat. Thank you, Lisa. Excellent. And what's one more risk factor? What do you guys think? One more.
Having obstacles in the way.
Yes, so our environment could be a huge impact as well. Perfect. Thank you for those that have unmuted themselves or dropped their answer in the chat. Excellent. So let's kind of review this together and see how well we did. So number 1, if it will go. There we go. Is a lack of physical activity. We have seen through different research studies that older adults that have a decrease in lower body strength and core strength often have poor balance as a result, which is a huge risk factor when it comes to falls. So lack of physical activity is the number 1 risk factor. Number 2 is our environment, whether that's our environment, our living situation or home, and also hazards out in the community as well. Poor nutrition and dehydration. We notice that often poor nutrition, whether that's not getting enough food into our system or not getting the proper nutrients from our diet, can lead to a cycle of fragility. Now, that is when we have that lack of nutrition, it often leads to lower levels of energy and can also have an impact on our muscular strength as well. And when that occurs, it can actually lead to further loss of appetite and kind of create this cycle of lack of nutrition and energy. And also we do see that when it comes to dehydration is many symptoms of dehydration like dizziness, lightheadedness, headaches, being tired, and also, having low energy due to dehydration are also similar symptoms that we could see relate to increased risk of falls as well. Number 4 is what was mentioned during our little group participation there, which is medical and health conditions that may be pre-existing, can also contribute to our risk for falls. In the chat, someone mentioned medications. And last but not least is behaviors and choices. So I've had a couple of people ask, what does that necessarily mean? Is when the individual chooses to actively participate in behaviors and choices that could increase their risk for falls. For example, choosing not to wear the proper footwear or clothing to go outside for a walk, wearing something inappropriate like slippers where they could be more susceptible to tripping and falling, or maybe trying to tackle tasks or chores around their living space that they should be done with assistance or taken over by someone who might be a little bit more independent and capable of completing those tasks. So that's what that means by behaviors and choices. Now, as we can see, the risk factors for falls are numerous and they are often complex and can be interrelated. So with that being said, we don't want to necessarily get caught up on just dealing with one risk factor. That's a good way to get started on your health journey, but we do need to try our best to look at the bigger picture and realize how these different risk factors can be interrelated as well. So now that we've reviewed the different risk factors, let's talk about what you can do to reduce your risk for falls. What are some active steps that we can, start today right after this presentations, or things we can start advocating for in regards to our health as well? So what you can do. Number one recommendation from healthcare providers and various research studies is to get active. We do see that older adults who stay active are less likely to fall, less likely to get injured if they do experience a fall, and overall better recover from fall-related injuries as well. Now, a lot of times, people might not know how they can get started in becoming more active and reducing the amount of time they are sedentary. So to help with that, the Canada Public Health has a physical activity guideline available for Canadians to refer to, just to help them get started on their journey. So two big things that they recommend for older adults, that's individuals 65 and up, is they recommend that you participate in strengthening exercises at least twice a week. So some sort of activity where you're placing your muscles under resistance to help improve strength and endurance. And like I said, the goal is to try to do that at least twice a week. Now, the other recommendation they have is that older adults should be getting 150 minutes of moderate to vigorous aerobic activity each week in bouts of 10 minutes or more. Now, that recommendation is a little bit more of a mouthful. So let's break that down just a little bit here. So aerobic activity just refers to any type of physical activity or movement that gets your heart rate up, gets your blood flowing, you feel a little bit warmer, and you might be breathing a little bit heavier. So with that also allows you to work at a moderate intensity as well. Now, a lot of times people get a little scared about trying to work or move for 150 minutes. Now, that's not saying that you have to do that all at once, and that would be the goal that you would work to, not something that you have to do right at the beginning of your activity journey. And remember, as long as you're moving for at least 10 minutes, that counts towards your movement, and you're going to see health benefits from that. So, that could be joining an exercise class, that could be going for a walk with your friends or family, or maybe you have a pet that you need to walk. That could be just doing a physically demanding task, whether, it's raking the leaves, doing the laundry, walking up and down the basement stairs. Every little bit of movement counts, and it doesn't always have to be a structured exercise class in order for it to be considered movement and to get health benefits from it. So again, getting active, that's the number one recommendation. Second is we can look at our home and our community safety. So home safety, a lot of times people don't realize is that home is the most common place for older adults to experience a fall. And it's often due to tripping hazards that are in our home that can often be modified or removed from the environment in order for us to reduce those tripping hazards. So some things that we should look at in our home is number one, proper lighting in rooms and hallways. When we have proper lighting, we're better able to see obstacles that are in our path and navigate areas safely at night. So for example, in the bedroom, it is worth considering having a night light installed or some sort of light source beside the bed. Some people choose to have their cell phone so they can use the flashlight option, or sometimes even people have a flashlight beside their bed to use if they have to get up in the middle of the night to get safely to the washroom. So lighting is extremely important, and consider to remove tripping hazards in your space. Things like loose rugs or area mats should either be properly secured with a non-slip rubber backing, or they should be removed from the space. And also think about how you're organizing your home as well. For example, high traffic areas that are your entry or doorways or your hallways or paths to specific areas in your house should be obstacle and clutter free at all times. And that also includes if you have stairs in your home as well. We need to stop leaving stuff on our stairs in hopes that we'll bring them up or down later on. And remember, that is not a closet or your dumping ground. It is a pathway, and it needs to stay clear at all times. So not only do we want to think about removing things or tidying up our space, but we want to also think about what we can add to our living space as well to help us stay independent and safe as much as possible. And by that, I mean considering using assistive devices. So for example, a more common assistive device that a lot of seniors use is grab bars. So in the washroom area, whether you have a shower or a tub, it is worth having grab bars installed at the entrance and along the back of the wash area. That will allow you to get in and out of the bathtub safely, have something to hold on for support while you're bathing, and allow you to have something for support as you exit the bath area as well. Also look at, possibly installing one beside the toilet or the bed. Those are areas that can be very challenging when it comes to transitioning on and off those surfaces. So having a grab bar in those areas can help with that transfer. And also think about safety in the bathroom. This area gets wet, slippery very easily due to tile or porcelain that might be in that space. So ensure that you have non-slip adhesive mats in the wash area and outside as well, so you have a safe surface to step onto once you're done bathing. So again, there's lots of things we can either remove, adjust, or add to our living space to ensure that we are being as safe as possible and reducing a risk for falls. But we don't want to just think about safety in our home. Let's talk about ways we can be safe out in the community as well. So unfortunately, we do not necessarily have the power to, fix the sidewalks and do all the repairs that are obviously needed. However, there's precautions or habits we can get into to help ensure that our outings out into the community are as safe as possible. So for example, number one is, planning ahead. Check the weather. See what it's going to be like as you go out for your errand. Make sure you're wearing the proper clothing or footwear suitable for your task that you're trying to complete. See where you have to get to. Is there going to be a lot of traffic or construction in the area you're heading? Is there an alternative route you can take, or is someone able to drive you or help get you there safely? Also, if you're going to go out by yourself and you're someone that lives alone, maybe let a friend or neighbor know that, hey, I'm going to go out for a walk in the park at 11. I should be back by 11:30. And that way, if they notice you have not come back, then they might need to check up on you. So that buddy system can be very important as well. If you have a cell phone, make sure you bring the cell phone with you. And also consider your mobility aids. And that's also the third point that we can review about what you can do to reduce your risk for falls. So consider mobility aids. If a mobility aid has been prescribed to you, whether that's a cane, walker, wheelchair, walking poles, make sure you are using them. They have obviously been prescribed to you for a reason. Most often is because we have reduced mobility, whether it's due to a health condition, injury, or lack of balance, to assist with you walking safer. It's not to be mean, it's not to make you feel older, it's for a purpose. So with that being said, in addition to making sure we're using our mobility aids, let's make sure that we're using them properly and that they're sized properly as well. So question for the group, do we know what we use to determine the height of our cane or walker? What part of our body do we use to ensure that it's the correct height? Any guesses, or does anyone know? Good thing we're reviewing it today then. So when we are adjusting or sizing our cane or walker, we actually use the crease of our wrist to determine the height. So standing up nice and tall, arms straight down at your sides, the height of the handle for your walker or cane should be in line with the crease of your wrist. So that is an easy way to ensure that the mobility aid is at the proper height and for you to be able to walk with it properly. A great example is our walkers. So for our walkers, again, we're using that wrist crease to ensure that our elbows, when we're using our walker, is at a bend of 15 degrees. Now, if it is not at the proper height, there's two things that happen. If the walker is too high, what happens often is people walk with the walker out in front of them like they are walking or pushing a grocery cart far away from their bodies. As a result, then the walker is not close enough and you're not walking with it properly for it to offer support for your balance. And it kind of defeats the purpose of the walker. Now, on the other hand, if the walker is too low, we see two things. Either the individual is walking with their elbows locked or hyperextended, which puts a lot of stress on that joint, or on the other hand, we see them hunched over their walker with a lot of bend through the lower back, which is not great for our spinal health and can often lead to lower back pain. And the individual is not able to properly see where they're going since they're bent forward and often looking down towards the floor. So this is just some scenarios to highlight the importance of ensuring that your mobility aid is sized properly to you and that we're using it properly as well. So mobility aids can also help us in the community. So that is something important to consider as well. Number 4. Number 4 is to check your medications. So question for the group, you can either unmute or drop your answer in the chat box, is what are some important things that we should know about our medications? What are some important pieces of information we should be aware of?
Side effects.
Yes, very important is to be aware of the side effects. Side effects like drowsiness, lightheadedness, or dizziness are also side effects that could increase the individual's risk for falls as well. So it's important that if you are noticing these side effects when you are taking the medication, that it is worth maybe consulting with your healthcare provider to see if you can alter the dose, alter the time you're taking the medication, or look at substituting the medication with something else to limit those side effects. I can see we have a couple answers in the chat box. Excellent. Side effects. Yes, Lisa mentioned, best time to take the medications, making sure you know how to take your medications properly, what time, how long you should be taking it, how are you supposed to consume the medication. Is it supposed to be taken on a full or empty stomach? This can all affect your absorption of the medication, how effectively it works, and it can also help avoid the risk of interactions with our medications as well. We often see that older adults are at least taking 2 or more prescribed medications at a time. And also, we do see that that doesn't include supplements or over-the-counter medications. So being aware of the side of interactions with your medications, with other prescriptions, over-the-counters, other substances like caffeine, alcohol, or cannabis, and also foods as well, because there are some medications that you can't consume certain foods with. For example, grapefruit is an example for some medications. So that is important as well. What's one last thing we should know about our medications? One more important thing. Any ideas? Okay. So another important thing to consider about our medications is who we can talk to if we do have questions about our medication. So a lot of times it can be your family physician if you have one. It could be an RN or a nurse. It could be your health specialist. And most importantly, your pharmacist. Remember, your pharmacist is a specialist when it comes to prescribed medications. And oftentimes they're a lot more available and easier to reach out to when you do have questions about your prescriptions. So be sure to take advantage of their knowledge when you do have questions. Number 5. So number five that we can do to decrease our risk for falls is ensure that we are eating healthy and staying hydrated. So when it comes to healthy eating, we can use the Canada Food Guide as a starting point in our nutrition journeys. This can be accessed through the Canada Public Health website, or you can request printouts as well for the guide. And one of the basic ways they have suggested that we ensure that we're getting proper nutrition for the average healthy adult is that we look at proportions of the dinner plate. So if you take your dinner plate, half of your plate at each meal should be fruit and vegetables. A quarter should be some sort of protein food, whether it's, dairy products, meat, or alternatives. And then the last quarter should be some sort of whole grain food group. And based on these proportions, the average healthy adult should be able to meet their nutritional needs with minimal adjustments. Again, that's going to be dependent on your health and your diet and your food restrictions. So you may have to adjust that, but that is a good place to get started. And also you want to think about healthy eating habits as well. Are you ensuring that you are eating consistent meals throughout the day? So 2 to 3 meals a day. Are we making sure that we're getting enough nutrients in our food? If you have certain health conditions like osteoporosis, maybe it might be necessary for us to consider taking a supplement to help ensure that we're getting the right minerals and vitamins into our system to help with that condition. And also think about ways we can make sure we're staying hydrated. There's lots of different tricks and tips that we can do throughout the day to make sure that we're getting proper fluid intake. So easy ones is, pouring a glass of water for yourself at each meal. So 2 to 3 glasses a day right there. And you could also ensure that you have a water bottle with you to make sure you're consistently drinking fluids throughout the day, and or try to attach your fluid intake to a pre-established habit. So what I mean by that is, habits that you already have set up in routine while you're doing those tasks. Also try to have a glass of water at the same time. So for example, I've had some participants mention that every time they brush their teeth, they also have a glass of water right afterwards. Or when they're taking their medication, instead of just pouring just enough water to take their medicine, they actually pour themselves a full glass of water while they're taking their medication. So just little ways we can ensure we're getting more fluids into our system on a regular basis. And number 6, check your footwear. So proper footwear has been shown to help decrease or reduce the likelihood of falls. Now, that being said, not every pair of shoes we own are necessarily going to be perfectly supportive. And I'll be the first to admit that, I have shoes for, special occasions. I have sandals and flip-flops for the summer. However, the shoes that I wear when I'm being active or walking or standing for long periods of time are supportive. So, question for the group, what are some supportive features we should be looking for in our shoes? What are some key things our shoes should have if they are supportive? What do you guys think? Any ideas? Okay, someone in the chat. Straps, well-fitting, excellent. 2 great points. Thank you, Madison and Lisa. So number 1 is make sure they are properly sized and have a natural fit. With that being said, that means no more than a 1/2 inch space in the shoe to avoid your foot sliding within the shoe. Ensure that there's no pinching, chafing, or blistering happening. And in the toe area of the shoe, you should have enough space to comfortably wiggle your toes. That ensures that it is a natural fit and it is the correct size. Always take advantage of trying on the shoes if you can. A lot of times you can try them on in stores and you have 30 days to return them if you don't wear them outside at home as well. So ensure that the shoe fits properly. And then Lisa added that our shoes should have some sort of adjustable fastener. This is very important because with the fastener, it ensures that your heel is locked into the shoe properly. Not only is it going to prevent the shoe from slipping off if you're doing a lot of movement, but it's also going to give your ankle a lot more support and stability when you're doing movement as well. So that is any sort of lace, Velcro, buckle, drawstring, or button. Now, I know the slip-on shoes are really convenient, allows some people to be a little bit more independent while getting dressed or ready in the morning. However, over time, the elastic on the slip-on does wear out and it no longer holds or snugly secures your heel in place in the shoe. So that's why it is recommended to not wear slip-ons for activity. They're a good, casual, maybe, an indoor shoe, but not necessarily a shoe you should be wearing for support. And last but not least, consider proper tread on your shoe. Especially if you're planning to wear them outside or around the community, you want that additional tread to make sure it can grip and support you on different surfaces. Now, that being said, if you're someone that likes to wear your shoes in your home and you have a lot of carpeting in your space, be aware that tread actually catches the carpet due to additional friction and can become a tripping hazard. So your supportive shoes that you wear out in the community, you're doing active, are going to have more tread, while your indoor shoes, if you have carpet, you're going to want to go for a little less tread with that, just to reduce that friction and tripping hazard. So do keep that in mind. And the last thing we're going to talk about today about what you can do to reduce your risk for falls is having your vision and hearing checked on a regular basis. Here we go. So vision, I'm sure most of us do have a good understanding of how that can be associated with our risk for falls, but let's review it just quickly here. So when we have, nearsightedness or farsightedness, that can impact our ability to see obstacles or items that might be in our path that could be a tripping hazard. And, there could be also other associated eye health conditions as well that can impact our vision. So things like cataracts can cause the vision to be foggy or unclear. Glaucoma affects the peripheral vision, making it harder to see changes in surface levels or the edges of curves or other surfaces. or things like molecular degeneration affects the central vision of the eye, which can make it more difficult navigating your environment. So this is why it's very important to have your vision checked on a regular basis to ensure that our prescriptions are up to date and to catch and monitor any eye conditions that could be developing as well. There are some cases where you catch an eye condition in the earlier stages, you are better able to address the issue. For example, like cataracts, you can have the surgery done sooner rather than later. And or you could be taking prescribed medication to help reduce the progression of that eye condition, for example, like with glaucoma. So when it comes to having our vision assessed on an annual basis, eye examinations are covered for seniors under OHIP. With that being said, though, for a healthy older adult with no pre-existing eye conditions or medical conditions that can affect the eye health, the free examination is every 16 months now. However, if you have a pre-existing eye or health condition that affects your eye health, or you have prescribed glasses, then the eye examination is every 12 months. So there is a change in the OHIP coverage with that. And then second, we should also be getting our hearing assessed on a regular basis as well. Now, a lot of times we might not realize, but individuals with hearing loss are nearly 3 times more likely to experience a fall compared to those without hearing loss. So that is often due to a decreased awareness of one's surroundings, not being able to hear warnings, instructions, or signals that could help prevent scenario where a fall occurs from happening. So getting your hearing assessed is important. Now, with that being said, there are many situations where OHIP does not cover hearing tests. However, there are many organizations and larger companies like Hearing Canada that do offer free hearing assessments for older adults without the expectation of purchasing hearing aids. Now, OHIP does cover hearing tests only if they are being done by a ear, throat, and mouth doctor during an appointment. So you do need a referral from that. In any other situation, though, the OHIP does not cover hearing tests. So that's why it is helpful to go to organizations like Hotel Shaver, Hearing Canada, to take advantage of those opportunities to get a free hearing test done. Because again, it's going to help ensure that you're catching changes that are happening with your hearing and ensure that you have the proper equipment if you do have significant hearing loss, for example, maybe getting hearing aids if it's needed. So again, these are just simple things that we can start working on or make lifestyle changes starting today to help reduce our risk for falls. So hopefully this was very helpful in, helping you guys realize that some of them are lifestyle changes, while as others is managing our health to reduce those risks for falls. Now, just to want to wrap up here, I just want to review what the different resources are available that you could take advantage of to help improve your knowledge of fall prevention and to help you with your health journey as well. So specifically with the VON, we do have free exercise programs that are available for seniors in the region to take advantage of and participate in. So our first program is the SMART exercise program. It is a free ongoing senior group exercise program at different locations throughout the region. We have classes in Hamilton, Brantford, Burlington. We also have them in, Niagara as well. So these locations are either private. We have them in retirement homes or long-term care homes, but we do have some locations out in the community. And we're also happy to announce that we are having our first virtual class as well on Fridays through our caregiver education program, where caregivers and loved ones can join us Fridays mornings on Zoom to go through the exercise routine. So for any of our class locations or virtual programs, registration is required, and they are facilitated by a certified fitness instructor. And all our exercises focus on increasing and maintaining strength, coordination, balance, and flexibility, as well as reducing the risk of falls. Now, our exercises are based on recommendations from Osteoporosis Canada. So they are low impact and gentle on the joints. And we always provide seated options. So all our classes can be done seated or standing, and they're self-paced with no floor work. We do not get any of our participants down on the floor to do any exercises. So it is often a group that anyone of all abilities would join and participate in. And we do have individuals that have stroke or who are stroke survivors, who live with Parkinson's. We also have memory care groups as well for those with dementia. So we do try to have everyone involved in our classes, and it's not just for healthy individuals. So if you are interested in our SMART program, my contact will be up at the end of the presentation here in a moment, and you can reach out to see what location is closest to you, or learn more about our virtual program as well. In addition to our exercise program, in January, we will be also starting a fall prevention program. So a little bit of an extension or expansion on this presentation today. So similar to our SMART program, it is a group-based class that is for 12 weeks, where it's an education and exercise program. So each session we would start with a health talk regarding a topic related to fall prevention, and go over it in detail for about 15-20 minutes, followed by exercise afterwards for about 30 to 45 minutes. Just like our SMART program, it is free, and we do require our participants to register. In addition, though, to the program, we also do conduct a pre and post exercise assessment to determine participants' progress in the program as well. And also we do provide resources and materials that the participants can always refer back to once they have graduated from the program. So that will be starting in January. I will be the only instructor for this program, as I am a registered healthcare provider. I will be leading this program. So in person will be in Niagara for the winter to start, but then I will be rotating to locations in Hamilton for the spring, and kind of just going to different areas from there. But we are also working to offer this program virtually, just for those who might not be in the region where the program is being serviced at the time, so they can participate as well. Again, you can also reach out to me if you are interested in learning more about the fall prevention program. Not only are there programs available, though, we also have free resources online through many different providers that you can always refer back to, in addition to the resources you're going to receive after this presentation as well. So some awesome websites that I like to use for information, or also ones that I often provide my participants, is the Fall Prevention Month website. Is excellent. It is specifically Canadian and has lots of great resources for not only seniors, but caregivers and healthcare providers as well. You also have Finding Balance Alberta. It does have information specific for individuals living on Alberta, but a lot of the health education is applicable to anyone, not just for people living in Alberta. We also have the 24-hour movement guideline. This is the updated version of the physical activities guideline set out by Canada Public Health there. So always worth refreshing your knowledge about, how to stay active and what are some things you should focus on in your physical health journey. And of course, we have different public health websites like the city of Niagara or like the Niagara region public health sites, excellent, as well as the Hamilton. And there's also Canada Health as well that you can always refer back to that has a lot of printouts, video links, and websites mentioned on it as well to help improve your knowledge too. And with that being said, that brings us to the end of our presentation today. So we've covered a lot of information, but some of the key things we touched on is, why is fall prevention important? Why do people fall? What are those risk factors? What you can do lifestyle wise or things that you can advocate for in regards to your health to reduce your risk for falls. And we also quickly reviewed, what programs and additional resources are out there to help you with your health journey as well. So thank you guys so much for joining today and listening to my presentation. Here is my contact information. You can either reach out to me over the phone and leave me a voice message, or you can email me if you'd like to learn more about the Smart Exercise program or our new fall prevention program. And again, thank you so much for listening.